Hello, good afternoon. Today we are going to talk about supracondylar fractures in children. So they are very important in children fractures. This is one of the fractures which is considered as an emergency in children fractures. So most often they require surgery or it is essential to operate them to keep it in position. So actually, what is supracondylar fracture? It is a break in the bone just above the elbow in humerus. That is called supracondylar fracture. In layman terms, it is a break in the bone of the upper arm near elbow. So that is also a definition for supracondylar fracture. So what are the risk factors and how does that happen? So most commonly this happens in children aged between 5 to 8 years with the most common incidence in 6 years. So the fall is usually on a outstretched hand. Whenever there is a fall on outstretched hand, the elbow gets locked and it goes into hyperextension and then it starts breaking. So if you see it here, the olecranon gets locked on the olecranon fossa and then hyperextension that leads to the breaking force and leads to the fracture. So this supracondylar fracture. So it happens just above the elbow. It's not an intra-articular fracture of the elbow. It is actually extra-articular fracture. So if you take symptoms, there will be very severe pain, swelling, and then there will be deformity, which is noticeable, and even slightest movements will cause severe pain in the baby hand. So when you do a physical exam, we have to check for pulses and neurological status because whenever there is a supracondylar fracture, there is high chances of brachial artery or median nerve injury, and in some cases you might even see radial nerve injury also. Most of the people think that it's ulnar nerve injury, but no, it is not actually ulnar nerve injury. The most common injury is median and radial nerve and also brachial artery. So brachial artery injury might be from complete uh, transection to thrombosis, intimal damage leading to the thrombosis. So what is the classification? Classification, there are four types of supracondylar fractures. One is type 1, type 2, type 3, type 4 deformities. So type 1 is non-displaced. Type 2 is slightly angulated, which can be corrected. These two falls under conservative treatment. Type 3 is completely displaced, but it is not grievously displaced, but these fall under might require surgery because these are very unstable fractures, require stabilization. If you have to stabilize it, you have to keep it in full flexion. So this full flexion causes sometimes vascular issues. In type 1, management is mainly in type 1, it is about cast application in flexion. And in type 2, 3 also you can do closed manipulation and apply skin above elbow cast, but in flexion, that is because it can be done under anesthesia or without anesthesia. And it is considered as an urgent treatment because this usually affects the blood supply to the elbow. After every procedure, before and after, we have to check vascularity of the limb, radial artery pulse. Once there is no radial artery pulse, we have to check whether the limb is pink or not. If it is not pink, we have to explore the brachial artery and do, if it is transected, we have to do suturing and all that. So we must have, if then there is no radial artery pulse, we have to always keep backup of the plastic surgeon or vascular surgeon for vascular procedures. So this is a case where it was operated. He was put in pins and it is stabilized, and the pins will be removed completely after 6 weeks.